Yeah. Kunikova.
Shkinikova.
Yeah.
Okay. Hey guys, welcome to another episode of the Better by the Numbers podcast ran by Life Metrics. We're at the third annual Roundtable of longevity clinics. We're here with Sophia. Sophia, what are you doing in longevity space currently?
Hi, everyone. So I work for GlycanAge. We are a biological age company, and our angle is actually looking at aging through the lens of chronic inflammation. So
Okay.
we know it's one of the 12 hallmarks of aging, but it's actually very difficult to measure. So we have a special technology that actually allows us to capture this low-grade chronic inflammation.
Okay, what is that? What is the special technology? What are y'all doing with like lab testing? What's the uniqueness of the company?
So the uniqueness actually lies in the biomarker that we use, and the biomarker we use, they're called glycans, hence the GlycanAge, of course.
Right.
And they're complex sugar molecules attached to 60% of your proteins, and we focus on one specific protein, which is the IgG. So depending on what types of glycans we find attached to your IgG, we're actually able to understand whether your immune system is tipped more towards a pro-inflammatory profile or an anti-inflammatory profile. And what we know, like where the biological age factor comes in, is that when we're young, usually our glycans are anti-inflammatory. And then as we get older and adopt more of the unhealthy lifestyle habits, maybe, or start developing some sort of a disease, they become more pro-inflammatory. And we know the exact pattern in which this happens. So this is how we're able to give you the biological age, but then also insights into your chronic inflammation and actually what to do about it and how to manage it.
What is I guess skyrocketing that trend? What do you think? Like, is it the food habits? Is it what we have like in the grocery stores? Is it our lifestyle habits? You're saying that it happens over time. So like, I guess aging. What is the pattern that you're seeing in most patients that it's coming up?
I think it's a combination, of course, of all of these factors, but one that we think is actually very interesting nowadays is stress. So the busy lifestyle that we're leading, just not having the time to invest in ourselves, to slow down. We actually see people that are diagnosed with depression, anxiety. They have, on average, a biological age which is 15 to 20 years higher than their peers.
Wow.
So the mental health, which combines, of course, the stress, depression, anxiety, and all of that, is a huge driver. Of course, alongside everything else that we know from
Right.
exercise, diet, hormones, and so on.
What are some test cases that you have, like, I guess you've been able to measure in your company? What are some test cases that you're like notable, that are noteworthy, that you're proud of, that I guess you helped somebody either lower their biological age or just, I don't know, either adopt a healthier lifestyle?
Yeah, we have many clients, over the years that have really been able to optimize their health. So of course, with our test, it's something that you have to remeasure. So of course, you'll have your baseline, but then the whole point is for you to reiterate, optimize as you measure, and you can remeasure your biological age in every 3 to 6 months, depending on the intervention. One of the cases that does come to mind is actually hormone optimization, and we focus a lot on women in this perimenopausal period, where we often see them not being diagnosed properly and not getting the actual care that they need. So the symptoms get misdiagnosed as maybe a mental condition or something else. So with our test, it's actually, for some clients, it's the first proof that something is actually wrong. Like they have this on paper, they're not imagining that they're having this issue, which is due to the loss of hormones. So I think these cases are really, really powerful for us.
Okay, and last but not least, I guess what are some of the takeaways that you've been learning here at the Roundtable of Longevity?
I think there's been a lot, but one thing that does come to mind is actually this collaboration, because obviously longevity is such a new space and there's so many people that want to get into it and they do get into it, but it's very difficult for us all to sit down together to exchange ideas. And I think, this is a great platform for that. So just talking and, just understanding that we're all facing the same issues,
right,
is very important. And actually, sitting down and trying to talk through these and, align
and trying
on
to come up
everything
with
else.
solutions, right?
Exactly.
Nice,
Yeah,
nice.
exactly.
And what are you most looking forward to? Not just here, I mean, in your company. Like, what are you most looking forward to?
There's a lot of exciting things happening. I don't want to be the person that says AI, but I
Right.
think AI
Yeah.
is very
It's taking over. It's taking over. Yeah,
exactly. It's taking over, and I think we have to utilize this for for our clients and for our providers. So right now we've actually created this AI assistant for result interpretation, which I think is huge because we're able to combine not just the glycan age results, but other results, from other testing, whether that's routine testing or anything else, and give like a complete picture to our providers. But I think for us, we really want to bring glycans into every lab, every hospital, every clinic. So that's kind of the 10-year
And
plan for us.
where are you guys at now, I guess, with that?
So right now we have the base lab, which is in Zagreb, Croatia. And we've recently opened a lab in Irvine, California, which is a CLIA certified lab. And then one which is more of a research lab in the Northwestern University. So we're expanding
slowly but surely. Got it.
Exactly.
Okay.
Exactly.
Well, thank you for joining us. I appreciate it.
Absolutely. Thank you
That's
for having
it
me.
for this episode of Better by the Numbers. How can we find you?
So you can find Glycan Age at LinkedIn. You can find us on Instagram. But maybe the best way is just to visit glycanage.com and learn a bit more, whether you're a consumer or a provider.
All right. Thank you. Live streaming at the 3rd annual Roundtable of Longevity Clinics. That's it for this episode. Thank you so much.
Thank you.
All right.
Okay.
Man,